In 1899, aspirin was patented. Before that, the major treatment for pain was medical marijuana, was cannabis. It was treated for 212 different diseases. Today we have two common types of medical marijuana in the 11 states that allow it. There's the cannabis that we see on the street as the natural herb that we smoke, not us, but patients smoke. Or there's the synthesized kind, which is different compounds that are found in cannabis. So normally they're labeled tetrahydrocannabinoids. You can have different types of tetrahydrocannabinoids, or we can just call it THC. You can have different types of THC, 9 THC, 8 THC. I think you can have like 7 or 6 THC also. So should doctors have the ability to prescribe marijuana? Marijuana is a drug that has a very bad connotation to it. It's a very negative connotation. It's in the 70s, it was one of the drugs that people went to orgies with and had lots of sex. So why would we want to use that today? Because it's an alternative to the drugs today that don't cause a lot of the side effects that patients have to deal with. Marijuana should only be prescribed for people that are suffering from serious or terminally ill diseases. Terminal diseases. Such cases would be ADD or ADHD, which is a potentially debilitating disease. Cancer patients, people who suffer from chronic pain, migraines for a week. If you're throwing up and you can't function, that would be chronic pain. Glaucoma, eating disorders, AIDS, chemotherapy, and anxiety is another one. In AIDS patients, the traditional cocktail of medications cause many different side effects, like nausea and vomiting and loss of appetite. And those are the three major side effects that are hard to treat. So marijuana works to aid those different side effects. And marijuana aids the side effects without causing any different interactions with the drugs. In multiple sclerosis, marijuana reduces the spasticity, which is the muscle tone in muscles that causes tremors and spasms. It relaxes the neural pathways in the muscles, which allow the muscle to relax. It reduces nausea in chemotherapy patients, which promotes healthy nutrition. If they're able to reduce all the vitamins and nutrients that they are eating, then they're able to recover more from the chemotherapy, from the poison that they're getting in their bodies. Kids or adults with ADHD or ADD are able to focus more. In San Diego, there's about 12% of patients that are under the age of 12 that are taking cannabis. And they've all reported positive results in school. In glaucoma patients, it has been proven to reduce the intraocular pressure of the eye, which a lot of drugs can't do without negative side effects. But with glaucoma, it has to be introduced into the body a certain way. So how should it be used? It should only be used for these life-threatening illnesses or potentially debilitating illnesses. And it should be used just like any other drug like Vicodin or Oxycontin or morphine. If a kid is using it and they're going to school, kids aren't allowed to walk around school with Vicodin or Oxycontin in their pockets. So why would they be able to walk around with marijuana in their pockets? It has to be taken to the nurse's office. It has to be stored and administered at the nurse's office. It doesn't have to be smoked, and it should not be smoked, especially for minors. Anything smoked kills the cilia that are really helpful to your health, that filter out all the different particles in the air when they get to your lung. They also hurt the alveoli in your lungs. So that's smoking. It can be smoked, but many physicians would prefer it to be taken in the form of pills, like THC pills, Marinol, different stuff like that. They can be baked into cookies. A doctor at the University of Southern California has suggested that parents bake their marijuana into the cookies or peanut butter to spread on toast for kids that suffer from ADHD or ADD, because when you smoke it, it has a less lasting effect. It doesn't last as long as when it's ingested through the digestive system. So they're able to stay focused and calm more throughout the day. It promotes healthy appetites in patients, especially patients that have anorexia or bulimia. With chemotherapy and AIDS also, like we mentioned, it's very difficult for people to keep all the food down, especially when they have all that poison in their blood. There have been multiple double-blind studies that have proven that these different effects that marijuana has on multiple sclerosis and glaucoma and AIDS have proven to be beneficial. So why not just take any other pain medication? Why not take Demerol, morphine, or Tylenol, or aspirin? Well, for Ritalin in ADHD, there was a reported 289 different exposures to overdose. And 31 developed signs of overdose, like vomiting, tremors, or hallucinations, convulsions, sweating. And those are little kids. There's never been a fatal overdose that has been reported to the US federal government for marijuana. So, would you rather endorse or have doctors prescribe medications like morphine or different Vicodins, which in 2006 in Oklahoma caused 603 different incidences of overdose and death? 327 were solely Vicodin. Or Tylenol in 2001 had reported 57,000 overdoses. 30 were accidental, 20 were on purpose, and of those, 120 were fatal. Would you have the doctors prescribe morphine or Demerol, which are highly addictive? Any painkiller has the potential to become addictive, and the numbers keep increasing. In King County in Washington, Seattle, Washington, there were 148 different deaths from Vicodin, and that's up 572% from 1997. So which would you have doctors prescribe? Marijuana or the natural painkillers that we have? They're not painkillers, but people killers.